Hello and welcome back to GP Video Podcast by Nadia. So in this short video podcast, I would like to emphasize on 2 points that I would like you guys to remember. Number one is bone health is very, very important, and there are tips to prevent osteoporosis and improve longevity. I will talk in another podcast about that, but I've already spoken in my previous podcast about how can we prevent osteoporosis, and it's very good to know that there are screening procedures, screening processes in place in which we can find out if our bones are osteopenic or osteoporotic or not. Osteopenia is the stage before osteoporosis. So bone health can lead to death. I mean, if you don't look after your bones, if you get osteoporotic, you get bone fractures. Bone fractures will lead to chronic pain. Chronic pain will lead to disability, and disability can eventually lead to death. So bone health and tips to prevent osteoporosis are very, very important. So that's number one. Number two is, what is the difference between osteoporosis and osteoarthritis? Because some patients get quite confused between these two terms, osteoporosis and osteoarthritis. So osteoarthritis, as the name indicates, is about the joints. So what happens is that the end of the bones, which are covered by cartilage, a covering surface or protective surface, that is the disease of this cartilage or the protective surface that becomes gets worn out, and then it causes pain and it causes the joint movement issues. So that's called osteoarthritis. Arthritis means the inflammation of the or problems with the joints. While osteoporosis is actually the problem with the bone itself, where the bone mass, bone structure gets really fragile, and then these bones are more prone to get broken. So that is the problem with the bone mass itself, while osteoarthritis is the problem with the lining of the bones that are making the joint and the problem with the joint movement. So osteoporosis and osteoarthritis are two different things, completely different things. And what we can do is we can actually prevent both of them, but preventing osteoporosis is like really, really very important, and we can do that. And I'll talk to you about how can we prevent osteoporosis, and who are the people, men and women both, who need to be screened for osteoporosis. Because usually, unfortunately, what happens is we get to know about osteoporosis or weak bones only once we've got the fragile bone fracture. But nowadays, because the screening processes are in place, I would tell you the name of it. We all know about it. It's called bone mineral density scan. So with bone mineral density scan, we can get to know whether we are osteoporotic or not, and then we can take medications for it. While there are tips to even prevent osteoporosis, which I will come to in another podcast, but just to let you know, we can have vitamin D and calcium in our diet. We can, like, up till the age of 25, we build our bones. So all these exercises, climbing and running and all of that kids do, we should really encourage that, because up till the age of 25, by doing all these exercises, they build up their bone mass. So that is very, very important. Being active is important. Vitamin D and calcium are very, very important. Perimenopausal and menopausal women, HRT, hormone replacement therapy, is very, very important. And there are some other tips too that I will share in my next video podcast.